Last week, we conducted our first Twitter poll to see what our viewers are most interested in, and overwhelmingly, you guys said you wanted to hear more about advances in COVID science and governance. So first, we're going to throw to Professor Juliet Khayyam and ask her how things are changing on the ground logistically, both in Massachusetts and across the country.
Well, of course, all the viewers will know that we are in the opening up phase. Apparently, we got there real fast. My cynicism is a suggestion that this is being based on politics rather than science. It doesn't, most of the opening up doesn't even satisfy the White House's rather lax standards for opening up, which was, of course, 2 weeks of decline. We are letting up too early, and my sort of passion in saying that is, okay, what's plan C? And so I'm focused on that because if maybe we lost the war, but we can win a few battles, and that's going to be to protect vulnerable populations, to avoid, to continue on with testing, to try to educate the public around things like not going to major events. And you are seeing the public respond in interesting ways. I mean, I call it the new Waffle House Index, which is Waffle House Index is something we use in hurricanes to describe how bad a hurricane is. If a Waffle House, this all-you-can-eat diner, all-day breakfast diner in the South is closed, it means that it was really bad because they never close. The new Waffle House Index may be that people aren't showing up. They're open now in Georgia and Texas and elsewhere, and people aren't showing up. Our social norms have changed, and it's going to take a lot. So basically, that's where we are. Massachusetts is holding firm for now, which is good, but our deaths aren't going down. Opening up is not a moment in time. It's not stationary. It's going to be guesses and lessons learned. But the idea that we're starting with recreational restaurants and other things like that is really bizarre. There's my dog live, is very bizarre. We need to focus on the fundamentals of our economy and our kids and schools, and we can figure out fun later. Let me just put it that way.
Dr. Bourdeaux, last week you talked about how this sort of frantic wanting to get back to normal is also pushing people more towards junk science, the idea of a miracle cure, that sort of thing. I know there are a lot of clinical trials happening right now, anything from CBD to giving men estrogen. So talk us through what actually looks promising, what actually looks like it might be useful, and what's going on in our hospitals.
Yeah, I mean, I think the message we're trying to get across right now is that, we brought a bazooka to the economic fight and a water pistol to the public health fight. And we need to reverse that. We need to bring the bazooka to the public health fight. We've let our public health system deteriorate, frankly. And so we need hundreds of billions of dollars to build that back so that we can all be safe. That's where we need to head. Now, in terms of what's promising in terms of the medicine and the vaccines, there are a large number of compounds that are being tested to see if they're efficacious. I think, and then the vaccine development is particularly exciting, actually, because after Ebola in 2014, there were some really interesting efforts put together around the world to try to create the platforms for rapid vaccine development. And those platforms have been great. I mean, they've been really working. One is CEPI out of Norway. There's been a couple in the United States, very promising stuff, but there is a long way to go. Even if we have the vaccine, right, we're going to have to think about how do we distribute that. Start thinking, the problems we had with testing, like nasal swabs, that's going to be, huge in terms of vaccine development. So that's a long process, and there are promising things. We're making our way, but we have some battles to win in the meantime before the vaccine.
Thank you, Margaret. Well, in our last clip, we talked about how, unfortunately, we are not condoning people bringing in childcare help just yet. It looks like we are settling into a summer that may not even have summer camp. Yeah. Dr. Bourdeaux, for our Sanity and Sanitation segment, talk to us about what we can do to stay sane in a summer without summer camp.
I just want to acknowledge the hardship involved here. And so I am acknowledging that this is a really hard thing. I don't have great answers. But what I will say is I've been a little inspired by my now 13-year-old, one of my children. She's been very inventive. And one of the things she's decided to embark on is a big project that she's rallied her sisters around, which is cooking a dish from a different country every night until they work through 194 countries in the world. So we've had a strong start. We've had cookies from Argentina and naan from India and borscht from Russia, among many others. And that's just been a wonderful little project that's been sort of big in its scope and scale and ambition, but has kind of provided this daily little sanity and fun for our family.
Wonderful. Thank you so much. Well, your daughter is definitely making the rest of us feel like slackers, but if there's anything similar that you can do with your kids at home, definitely have as much fun as you can. Thank you so much for joining us. This is Questions from Quarantine, and please feel free to hashtag Questions from Quarantine for your chance to be answered next week.